fractionated CO2 laser skin rejuvenation. Try saying that 3 times fast. What role does that play, the anti-aging and skin texture? And what other maintenance treatments can we do to see?
Probably not enough time to discuss all of that, but I would say, yeah, fractionated CO2 laser treatments are treatments that I use either in office or during surgery to resurface the skin. More aggressive CO2 laser treatments are safe for lighter skin types and not for everyone, because some of the treatments can cause hyper or hypopigmentation. So not everyone's a good candidate for the more aggressive CO2 laser resurfacing procedures. Good news is that we have in-office mild CO2 laser treatments or other radiofrequency type treatments that can help tighten skin, resurface the skin. But the milder treatments take a few more in a series to get to the same level of treatment as the more aggressive, maybe more one-time fractionated CO2 laser treatment. CO2 laser treatments, the way they work, it's a laser that's dialed into a specific wavelength that attacks water in your skin, basically. So the water heats up and it injures a percentage of your skin. And by doing that, the surrounding skin also rejuvenates. It stimulates collagen production, it stimulates elastin production, which helps to tighten your skin. It helps to close pore size. It helps to bring out more healthy, youthful layers of skin from the deeper surfaces, and it exfoliates the outer layers of skin that may have fine lines or even deeper wrinkles around the mouth, between the eyes. These are all preventative procedures too over time. But if you're looking to prolong the aging process and look more youthful over time, laser procedures, whether in office or more aggressive treatments, can be the way to go. And they can really help you age more gracefully and look more youthful into your 40s, 50s, 60s, and beyond. So I would say those are some of the quick things I can say about those treatments.
Yes, and also, while you're here, please tell us about your signature and tree-carved eyebrow transcendent champagne brows. I feel like Bruno Mars should be singing a song about that, right?
It's not bad to have that last name, I guess, right? So my signature champagne brows procedure, it's a surgical hair transplant procedure similar to hair transplantation for the scalp. But what I did is I refined the procedure in order to create eyebrows for patients who have either over-tweezed, over-waxed, and they never grew back, maybe aging. As we all age, we tend to lose hair from the outside or from the medial part of the brow. You may have been born with sparse eyebrows, never really had much of an eyebrow. So the good thing about this procedure is it's a permanent result. I borrow hair, typically from the back of the scalp. Not everyone's a great candidate. It depends on your hair quality. Best hair quality has a slight curvature or two, maybe a tighter type curl, because we want to use hair that has curvature that looks more like eyebrow hair. I just finished one of these procedures about 30 minutes before I got here today. So I do a lot of these procedures, and patients love it because there are options like maybe you've heard of microblading or tattooing, where you can kind of create the look of an eyebrow, but it's just pigment in the skin, and it never really looks perfect. It doesn't give you the three-dimensional look. This procedure gives you your own hair, three-dimensional permanent eyebrows that you can style with either the rest of your hair, or I can create a fully brand new eyebrow from maybe nothing. So some of my patients come with 0 eyebrow hairs, and we can create a whole new eyebrow from that. So it's a bit of a process. It takes about 4 months to start seeing growth after the transplantation. But in the end, after that, 6 to 8 months later, you have permanent eyebrows. Forever.
Wow.
The one thing to know, because I borrow hair from the back of the head, and that's best quality, it keeps growing for the rest of your life if you don't trim it. So most patients trim it twice a week to kind of maintain it. I've never had anyone say that that's an issue, because most of these patients are drawing them in every day or just frustrated with them every day. So
it's amazing. And I have to ask what I think we're probably all thinking, if we don't trim it, is it like, can we braid it?
100%.
Oh
Yeah.
my gosh.
You can do like the mustache roll, Yeah.
I
but they look extremely natural when done right. Yeah.
It's wonderful. Thank you so much,
You're
Dr.
welcome.
Chance. And now, oh yeah, let's get it started with Dr. Jones. Champagne, I know.